It's time for Healing Utah, a program dedicated to helping Utahns heal from addictions to drugs, alcohol, pornography, and other addictions. Your host is Abby Bonnell, along with the co-founder and CEO of Utah Addiction Centers, Jeremy Bohlberg.
Jeremy, it's always fabulous to have you on the show. We have such a busy time right now. We've had Thanksgiving, we're all fat and happy and spent too much, and now we're looking at Christmas, and families are having lots of more time to spend together, and you start to see some of the issues even closer. You know, when we're all rushing around with our busy lives, you kind of don't quite see everything maybe as close as you do over the holidays when we're all forced together. We've been talking about the miracles that you see when someone comes in, especially the young children that you're treating now at the Utah Addiction Centers. You're located in Eagle Mountain, and it is a miracle. They come in broken, and it's amazing what your facility can do to heal.
You know, Abby, you're absolutely right. It's not the facility that heals. It's the individuals wanting to get help. It's the family supporting them, and it's coming into therapists who really know what they're talking about. I often say I've got the best job in the world. I really feel lucky because I watch miracles take place. I watch the atonement take place every day in my office. I get to see, I see things that will make or I hear things that make your skin curl. And yet to watch people overcome, forgive, and move on, and there's no better. I love it better than the paycheck. A year, 2 years, 5 years down the road, getting a thank you card, a text message from a previous client, a email of their success. To me, I go to work and I know what I'm doing is truly changing lives, and I think it's the neatest thing in the world.
And as an experienced clinical therapist, you're treating all kinds of conditions, all kinds of mental conditions.
We do, from mental health, depression and anxiety to mood disorders, personality disorders, all forms of addictions, eating disorders, self-cutting, self-harming behaviors, substance abuse, sexual and pornography addictions. These are our specialty.
And you say, listen, you can't be dealing with this on your own. A family, it's not enough in these instances, especially with addictions. I mean, you really need experienced professionals stepping in and intervening.
I honestly, I wouldn't do this alone. I am not my family's therapist, so if I ever have an issue or need something, I'm going to go to a professional and ask for help for them, because you cannot do this on your own. If you have these symptoms, if you're experiencing these issues, I strongly recommend getting professional help from a seasoned therapist who knows what they're doing.
Okay, and what is a good facility? I know you're the best of the best over at Utah Addiction Center, but can I just ask, what stands apart? What makes you so different from competitors?
Evidence-based treatment. I was lucky back in several years ago. I was the president of Utah Substance Abuse Association, and that responsibility took me several different directions. I got to visit Washington, D.C. I got to travel to various conferences throughout the nation, traveled all along the California coast. I've been through so many treatment programs as a guest to tour and evaluate. And the one common denominator that I saw amongst the most successful, the most expensive, most exclusive treatment programs is simple. They're evidence-based treatment. They're not making up as they go. As successful as we are at the Utah Addiction Centers, I would love to say, yeah, I created this therapy on my own. I didn't. I'll be the first to admit I'm taking what other people have shown as evidence treatment, and I'm implementing it, and I'm doing it at a rate that is affordable. If I were to take everything we do at Utah Addiction Centers and put it on a national level, I'd be charging anywhere from $40,000 to $60,000 a month. And at what our cost is, we're just a fraction of that.
And there's always a program you can work with a patient. Everybody is welcome. You'll sort it out.
Absolutely. For the listeners out there, there's several different types of therapy programs or therapists that I would highly recommend. If you're looking for substance abuse treatment, I would definitely go to somebody who is a licensed addiction therapist or a licensed substance abuse counselor, that they have skills and training in treating this disease. for somebody who's a sexual addiction therapist. Like, there's less than 35 certified sex addiction therapists in Utah.
And you're one of the specialists.
I am a sex addiction and a certified multiple addiction therapist. There's a lot of therapists out there who treat it, but they don't understand it because they haven't the training. And what's even scarier is there's a lot of therapists and researchers out there who are saying sex addiction and pornography addiction isn't a problem.
And what do you say to that?
I say I feel that they're flat out wrong.
Mm-hmm. You see it. You're treating
I see it
patients.
on a daily basis. It is absolutely devastating. It is traumatizing not only to the individual, but to the partner and to those who are producing it.
You do treat everything at Utah Addiction Centers. That hotline number is 801-766-2233, 801-766-2233. And it can just start with a phone call, can't it, and a conversation?
Absolutely. That's all it is. There's no obligation. That we're not going to try and sell you into anything. It's you talk to us. If you feel it's the right fit, great. Come see us and let's talk a little bit more.
And again, about all of the different disorders that you're treating, healingutah.com is invaluable. You're going to find a wealth of information there. You know, a new report just came out from the Surgeon General. It shows that Americans need to face up to the problem of addiction head on. The Facing Addiction report pulls together the very latest information on the health impact of drug and alcohol misuse. Pretty horrifying here. It says 1 in 7 people will face addiction. And even more sad, only 1 in 10 will actually reach out and seek treatment.
That's right. You know, we're lucky because here in Utah, we have several figures who are phenomenal when it comes to treating addictions and studying it. Dr. Kevin McCauley, I'm going to kind of give him a plug right now, is an addiction medical doctor who has really done a lot to promote and show how the disease of addiction truly is a disease. You know, and last week we talked about, one of the worst things we can do is just tell our loved one, white knuckle it, suck it up, quit doing it. It's not possible for an addict. It's not possible. And Dr. McCauley has shown neurochemically the reasons why we can't just stop the behavior.
The brain gets hardwired into it.
It is hardwired into it. And the part of the brain that normally shuts off that is incapacitated. It begin and over time it actually begins to atrophy or weaken, and so the cravings and it becomes stronger, and we're forced or compelled, even on an unconscious basis or level, to continue the behavior.
And you break the cycle. You teach somebody how to do that in a holistic way.
Absolutely. We teach you, and then we also do the underlying core work of what it is you're self-medicating. All of us who are addicts, we self-medicate. And if we can take that away, if we can take the underlying issues of what we're self-medicating and identify them and make them go away, what are we going to self-medicate? What's left? And so it's a complete holistic treatment. We're teasing out the core reasons, and then we're giving the individual skills and skill sets on learning how to live life without that and to remain in the part of the brain that is healthy.
And you're treating all kinds of disorders too, and we're talking about children, outpatient. You have residential facilities too, and really the best thing anybody can do right now, if you're listening and you know you have a son, a daughter, and they have just ignored this problem. They don't think they have a problem. That's the problem right there. This is the time, really, especially around the holidays when you're close with somebody. Do something, try and help them, but don't do it in a critical way. That's what you always say, Jeremy. Just so supportive, and it's a good thing. This is a great thing, just to pick up that phone and have a word with you. 801-766-2233. Jeremy is the co-founder and also a really experienced leading clinical therapist with the Utah Addiction Centers. They're based in Eagle Mountain. And you know what? What would you say to somebody right now if they're listening going, I'm at my wit's end. I don't know what to do. I've enabled. I've tried to do everything. I didn't mean to enable, but that's what I'm doing.
Okay, so I can picture it right now. They're standing in line. They've got their shopping addiction full on in force, and they're listening to this over the speaker and going, or driving to the store. What do I do? At this point, open dialogue, and not trying to solve the problem, not trying to fix it, but just trying to validate and love the individual. Try and find common ground. Let them know that there's hope. Let them know we'll do this together. Understand that neither the person that is the loved one nor the addict has all the answers. It's traumatizing to both. Let's go get help together. That's my recommendation to them. Anybody listening out there, if you really want to overcome this, it's not just the individual, the addict, who needs help. It's the whole family.
Give them a call. 801-766-2233, Utah Addiction Centers, or check it out at healingutah.com. We'll be back with more fine advice for you coming up right here. Healing Utah.
Welcome back to Healing Utah on Utah's Talk Radio 105.9 KNRS. Listen and you'll know.
Great to have Jeremy in studio. Jeremy Boberg, co-founder, of course, of Utah Addiction Centers. We were talking about young children starting to show signs, which is always a huge red flag, of depression and anxiety. And you treat children, too, on an outpatient basis at your facility in Eagle Mountain. How young are we seeing these signs of anxiety and depression in children?
We see a lot of our clients come in, for treatment, and when we get their real story, their life story, a lot of it comes from as early as 5, 6 years old up to 12, 13 years old. And you've got to look at what are the common denominators that create depression, anxiety, the need to self-medicate, addictions, and what it comes down to is what they're experiencing as children. The part of the brain just above the eyeballs, the cortex, is our cognition. It's our executive functioning, our ability to think and make choices. As children, it's not fully developed. And when a child experiences something trauma, they they interpret it differently than an adult would. For example, a child whose parents are fighting. Oftentimes the child believes it's their fault, and if I were just a better kid, my parents wouldn't fight. My parents wouldn't get a divorce if I were good enough. This is heartbreaking because it's traumatizing to the kid, and the parents are oftentimes so involved and enmeshed in their fight or the hurt and their anguish, they don't know how to compensate, and they don't realize what the kids are going through. And that's the part that begins. It's a foundation. It's the foundational block. It's being bullied at school. A new kid who goes to a new school and doesn't quite fit in. It's somebody who's introverted and goes into an extroverted crowd, and they're feeling isolated and withdrawn. That cognition, that foundation is fully developed, or solidified by repetition uses, so that it happens. I'm not good enough. All of a sudden comes in, or I'm a disappointment, or I'm worthless, or I'm ugly. All of these cognitions, they don't consciously think it; they feel it.
Low self-esteem.
And it creates the low self-esteem.
And then you start to see different behavior patterns. And it's not the kid acting out. It's not them going through the naughty teens.
Right. What it is it's they're consciously and unconsciously setting themselves up into similar experiences for the rest of their life, where the pattern replays itself over and over because of that underlying core belief of, I'm not good enough, I'm a disappointment. And so they, instead of achieving, they're demeaning themselves.
And then you start to see behaviors like eating disorders, addictions. This is why it's so important that you don't ignore it. You step in and take charge. And the best thing to do, really, Jeremy, you see this day in, day out, is give you a call, and you can decide then for yourself if this is the right course of treatment. But at the Utah Addiction Center, they have just phenomenal therapists that will sit down and unravel and get to the bottom of it.
We do. Absolutely. And please, any listeners out there, if you feel like anything we're saying right now meets home, call our hotline at 801-766-2233. I've got an operator on who will answer questions, bring you in for a free assessment or evaluation, talk you through, give you some suggestions. These kids, right now, often the majority of our kids who are becoming addicted or abusing drugs start around age 12 or 13. And it's the gateway drugs. It's tobacco, it's marijuana, it's
pain pills.
Pain pills are common. You usually see those a little bit more 14, 15, 16.
Wow.
But they're absolutely prevalent. Most people who are in the drug world who are were using probably by the age of 16. They were full on using weekend warriors, and they were experimenting. Many of them weren't quite addicted yet. They were just abusing. They were partying. Nobody grows up and says, "Oh, I want to be like my mom and be a drug addict when I grow up." It's a learned behavior, and once they feel the effects of a drug or a behavior, they like it. They're going to do it again and again and again, and that process, that repetitive process, creates neurochemical in the brain that says, "Do this again, do this again. This is good." And it literally becomes an unconscious drive as a means of self-medicating.
And your therapy can break that cycle.
Yes, it does.
You know, that hotline number, so important, 801-766-2233. You'll be calling the Utah Addiction Centers. They're based in Eagle Mountain. Jeremy Boberg is the co-founder and clinical therapist there with decades of experience. And you're so familiar with this. So many children are coming through your facility.
They are. And I think it's really important for the loved ones, especially through the holiday season, to remember their families. And love them and give them recommendations. Hey, I heard this guy on the radio. Here's his number. Let's call him and go together. Are you willing to?
And let's not forget, if you don't intervene, especially if there's depression issues with young teens, we've seen the suicide rates here in the state of Utah. It's a really sobering number. You really, really have to get help for that individual.
Absolutely. A lot of people say, not in my family. My child's not going to be suicidal. My child's not a drug addict. There is no exceptions to the rule. There's no age, no gender, no ethnicity, no religious, no amount of spirituality can come to this. It takes a plethora of therapy, spirituality, education. We at the Addiction Center, if I can touch on a few things that we specialize in, that we'd use to treat, if I've got time.
Just under a minute here, Jeremy.
We use as a supplement the 12-step programs. We use behavioral and educational therapy. We do family therapy. But our signature, what we really do, one of the core greatest things we use to help people with addictions and mental health issues is eye movement desensitization and reprocessing, the acronym EMDR. I highly recommend people look into these and get help.
Okay, you do need to call 801-766-2233 if you think you have a loved one in your family that needs some help. This is a phenomenal facility. It's the Utah Addiction Centers. Jeremy Boberg, thank you so much, co-founder of the facility, for joining me again. You always have invaluable advice for us. Thank you so much.
Thank you, Abby. I appreciate being on the show.
Happy holidays.
You've been listening to Healing Utah, sponsored by the Utah Addiction Center. Join us again next week at this time for a new conversation about the challenges of addictions on Utah's Talk Radio 105.9 KNRS.